Welcome everyone to Caring for Country, which is session 4. I want to welcome to the session 4 of CAHA's annual Greening the Healthcare Sector Forum, Caring for Country. We are so glad to have you joining us, and I'm delighted to be facilitating this session. A little bit about myself. I am Francis Nona, a proud Torres Strait Islander and a lecturer and an early career researcher at the Queensland University of Technology, the Currumbra Institute. My work is deeply informed by my strong cultural upbringing and balanced with my professional experience as a registered nurse and a director of Indigenous community-controlled health service. Throughout my career, I have worked in various clinical settings, including juvenile detention centres, aged care, rehabilitation units, brain injury rehabilitation, and Aboriginal medical services. I bring to academia a rich understanding of cultural engagement and protocols from my country, along with a comprehensive perspective on the health system as it applies to First Nations and other Australians. My research focuses on climate change and the health and well-being of Aboriginal and Torres Strait Islander communities. I'm deeply committed to improving the health of our communities, and through my experience and networks across academia and policy, I strive to translate research findings into practical outcomes. I'd like to start by acknowledging the traditional custodians on the lands we all gather on within this Zoom, wherever you may be joining us from today. For those that are here in Meganjin, Brisbane, we are meeting on the lands of the Turrbal and Yagara people. I pay my respects to elders past, present, and emerging. May we continue to learn from their wisdom and honour their care for country as we strive to build more sustainable and culturally respectful healthcare practices. I want to take this opportunity to give a special shout out to Bupa Australia, a platinum sponsor of this year's Greening the Healthcare Sector Forum. Their support has enabled us to bring this virtual event to life. A few housekeeping notes. At the bottom of your screen, you will notice the following: a discussion forum. So we encourage you all to share your reflections and thoughts throughout the session with other attendees in the discussion forum. There's also a Q&A, so please feel free to use this throughout the session, and we'll come to these towards the end of the session. As a virtual event, this is a must to make it interactive. If we can think of those questions as we listen to the sessions, we can also delve into those presentations. It's a reminder that this session is being recorded and will be available later via the platform for 4 months post-event. We'd love to hear your thoughts and reflections on today's sessions. We encourage you to please tag us at healthy_climate on Twitter or the Climate and Health Alliance on LinkedIn to get the message and word out. So again, I just wanted to say thank you again for joining us today. This session, Caring for Country, is an opportunity to reflect deeply on the rich and profound knowledge held by First Nations people of Australia. This knowledge, rooted in thousands of years of connection to the land and environment, offers us invaluable lessons about stewardship, sustainability, and holistic well-being. Caring for country is more than just an ecological concept. It's a way of life that emphasises the interconnectedness of people, culture, and the natural world. This perspective has sustained First Nations communities for generations and has the potential to enrich our healthcare systems today profoundly by integrating these values and practices into mainstream healthcare. We can cultivate approaches that care for individuals and the environment that nurtures us all. Over the next couple of hours, we will explore how traditional owner practices contribute to the well-being of elders, a cornerstone of cultural continuity and community health. We'll also delve into the importance of embedding cultural safety within healthcare settings, ensuring that First Nations people receive healthcare that respects their identity, traditions, and rights. We'll also hear about Aboriginal and Torres Strait Islander doctors' critical role in reforming healthcare systems to serve their communities better and improved outcomes for all. And lastly, we will close with a session on connecting with country in healthcare settings. So session 4 of CAHA's annual Greening and Healthcare Sector Forum, Caring for Country, is a call to action for all of us. Healthcare professionals, policymakers, and community members alike to embrace the wisdom of First Nations people. By doing so, we not only honour their knowledge and heritage, but also take meaningful steps towards a more inclusive, equitable, and a sustainable healthcare sector. As you listen to our speakers today, I invite you to consider how these lessons can resonate in our own practice, workplace, or community. Let's take this opportunity to reflect, learn, and commit to actions that bridge cultural wisdom with modern healthcare, creating a healthier, more connected future for everyone. We will now hear from 2 speakers from UnitingCare Queensland. It is my pleasure to introduce them both. First up, we'll have Jessica Abernethy, and she is an active team leader of the Reconciliation Action Plan team at UnitingCare, and she is dedicated to promoting reconciliation and addressing the disparities First Nations people face. She is passionate about equity, social justice, and enhancing healthcare services to ensure inclusivity and cultural significance. Following Jessica, we'll have Nikki Burns. Nikki Burns is a Yura Yura, Wemba Wemba, Durang woman residing and working in Yagara and Turrbal lands. Nikki is a Reconciliation Action Plan partner for UnitingCare Queensland for private, non-for-profit hospitals. So Jessica, first up, would love to hear your presentation, Enhancing Elders' Wellbeing Through Environmental Stewardship and Traditional Owner Cultural Practices.
Good morning, everyone. My name is Jessica Abernethy, and I'm a proud Anandili woman. I currently serve as the acting team leader for UnitingCare Queensland's Reconciliation Action Plan team. It's a privilege to be with you here today and to speak on the new initiative that UnitingCare have that connects healthcare to the cultural knowings of First Nations peoples. Before I begin, I would just like to take a moment to acknowledge the traditional owners on the land in which I speak from today, the Turrbal and Yagara peoples. These communities have been steadfast custodians of this land since the first sunrise, and for everyone since, holding a deep and enduring connection to their country and its people. I pay my respects to their elders, past and present, who have led with strength and resilience. I also extend my respects to the traditional owners on the land from which each of you is viewing this forum from today, and to the Aboriginal and Torres Strait Islander peoples who are joining us. I'm grateful for the opportunity to speak to this initiative. I'm just hoping that we might be able to play a video before I begin my presentation.
The Cubby Cubby traineeship program surpassed all expectations. It's been a win-win all round. Site, residents and the trainees alike have absolutely gone above and beyond. It's that realisation that they can do this, that they've got the confidence to do this, and that they truly have something to give back to their own people living on site, but to also share their cultural experiences with us. The smiles on their faces the day at that smoking ceremony really summed it up for me, that they really were proud to be sharing their heritage as part of their day-to-day job. They built this great partnership that has seen a great result for the site, a great result for the resis, and a great result for the trainees. The trainees themselves, they share their culture, their heritage, but they've been so engaged in the program. The learnings have been greater than what you see in the textbook.
As I said before, I'm grateful for the opportunity to talk about the initiative that closely aligns with UnitingCare Queensland values, the one that blends cultural respect in healthcare settings and the vital importance of the connection to country for Aboriginal and Torres Strait Islander peoples. It's an initiative that's being led by UnitingCare Queensland in partnership with the Kabi People's Aboriginal Corporation. It's based on the fundamental importance of First Nations peoples' interconnectedness to their own country. The importance of the connection to country for Aboriginal and Torres Strait Islander peoples in context is because country is not just a physical place to us. It's a living spiritual entity, an inseparable part of our identity. The land is where we find sustenance. The land is our shelter. The land is peace. And it's where our ancestors have walked. Everything in Aboriginal spiritual culture is viewed as alive, and thus the country to us is viewed as family. UnitingCare Queensland is putting these principles into action through the Kabi traineeship program. This initiative focuses on horticultural training for Aboriginal and Torres Strait Islander trainees, blending cultural care and connection with traditional practices on site in our aged care residents. The Kabi traineeship program is designed to offer meaningful employment and training opportunities to First Nations people on their country, caring for their people. The trainees learn how to maintain the land, promote native planting, and improve environmental sustainability throughout their training. The service areas that sit on Kabi country are designed to facilitate a minimum of two traineeships for horticulture trainees per year for the next 5 years. Through this program, we're integrating cultural practices such as facilitating monthly smoking ceremonies, native planting gardens, and caring for land, which we're seeing an enhancement in the experience for residents. The trainees, while they're gaining their valuable skills, they also share their cultural knowledge with other staff, and they've created deep-rooted relationships with elders, making a direct contribution to their well-being. Another key aspect that was identified in preparation for this program beginning was the better health outcomes that are available to Aboriginal and Torres Strait Islander peoples with the taking on the concept of holistic health. This approach sees health as an interconnectedness of physical, mental, and emotional, as well as spiritual well-being. Holistic health views the individual's well-being as inseparable from their family, their community, the spirit, and the land. By actualizing these cultural protocols, such as acknowledgement of country, involving elders in their decision-making, conducting the smoking ceremonies, and incorporating native healing gardens within the aged care residential facilities, our elders are surrounded by culture. They can see, smell, and feel the native plants and enjoy the wildlife that these traditional gardens are bringing. When healthcare systems embrace these cultural protocols, they can significantly improve patient engagement. Aboriginal and Torres Strait Islander patients are more likely to be seeking help and following their treatment plans. They're experiencing better health outcomes because they feel culturally safe and respected. This initiative is helping pave the way for a broader cultural shift in the healthcare sector, one that recognises the importance of the cultural respect of holistic health. This is an initiative that we aim to replicate across other service arms within UnitingCare's healthcare services. The connection to country is a fundamental aspect of Aboriginal and Torres Strait Islander health and well-being. This program at UnitingCare is a model for how we can create inclusive, culturally safe spaces in aged care services and other healthcare settings. I'd just like to thank you all for the opportunity to speak today, to share this initiative and hopefully inspire some other people to take on the connection to country in a healthcare setting, to see the benefits that it brings to not just our elders, but to patients in general. I urge you to continue to keep greening the healthcare sector by embedding historic knowledge and focusing on that connection to country into our practices. Thanks, everyone.
Thank you, Jessica. That was incredible to hear, and it makes me think back to, delivering healthcare, delivering these practices within healthcare facilities based on our elders' perspectives and ways of doing. And I just want to use this opportunity to share that, I've seen healthcare delivery within a regional area in Torres Straits, and we had new doctors fly in from the mainland, and what they thought was to deliver healthcare based on the complexity. So they wanted to get through a lot of cases before they got to the complex cases. And what happened is these doctors wanted to see the young first, and the elders actually seen it as a sign of disrespect. So they didn't engage at all. And the doctors couldn't understand how it was disrespectful. So I think this is this very thing that Jessica, you alluded to, working with the local group, the Cubby Cubby people, and understanding what is healthcare delivered on those terms, which is hugely important. So thank you for sharing that. And for others, start thinking of those questions before we go to Q&A. Next, we'll have Nikki Burns. She'll be presenting Embedding First Nations Cultural Safety in the Healthcare Practice. Thank you.
Thank you, Francis. Wanami, hello and good morning. Kia ora also to our friends in whānau in Aotearoa. My name is Nikki Burns. I'm a proud Yorta Yorta Wemba Wemba Darug woman, and I am the Reconciliation Action Plan or RAP partner for UnitingCare Queensland. I'm responsible for the implementation and cultural guidance of our RAP action items within our 4 private hospitals. And within that role, I also encompass providing cultural, emotional wellbeing support for First Nations patients who identify and indicate that they would like that support during their stay in our hospitals. Unfortunately, we don't have permanent Indigenous liaisons or First Nations cultural support services on site at these hospitals. So therefore, that's something that I've taken on in my role as a RAP partner in providing that for our hospitals. So my presentation today is in regards to the importance of embedding First Nations cultural safety in healthcare practice. Within this presentation, I will be providing some education and sharing of knowledge in regards to my own experiences as a cultural support liaison, and providing that sharing of knowledge and education to non-Indigenous clinical and health practitioners and stakeholders in order to provide a sharing of First Nations knowledge, practices and values. I feel that understanding these ways, First Nations ways of knowing, doing and being, along with cultural considerations related to them, can contribute to culturally safe care and improved healthcare outcomes for First Nations peoples. So much like Jess said before, when we speak of caring for country, for me, country is not just about the physical land, water, sea, sky. It's about weaving holistic well-being of connection, place, spirit and culture. And for me, Aboriginal and Torres Strait Islander peoples, we are country and country is us. In terms of country being cared for, you can also see when country isn't cared for. And when you can see that we as First Nations peoples look into the care and well-being, so historically and currently, that we can see that the health system has not been a safe place for us. Therefore, if you're looking at a disconnection or a separation of health care or well-being in terms of caring for country, you can see that also about who we are as peoples and our own well-being. And the feel of that disconnection and separation from our ways of knowing, doing and being has led to the current disparities of health inequity and social and cultural determinants of Aboriginal rates of health. We see today the challenge, and obviously the hospitals is firstly where I see that it needs to be addressed in terms of providing cultural support for First Nations patients and their well-being, and the fact that we couldn't provide that on site at the hospital unless I could go and physically or call and visit them or call patients to provide that sort of service and support. So it's about educating really and trying to ensure that educating nursing staff or clinical practitioners or whoever else may be providing care or treatment to First Nations patients about some of these aspects of cultural considerations that need to be taken on in regards to the historical trauma that, with marginalisation, oppression, racism, and what that does to someone's spirit and well-being. and to also understand what it means for Aboriginal peoples to go into a hospital when there's not been a safe space for us. For instance, when a woman has gone to give birth and maybe the baby has been taken from her, obviously removes them from her without her knowing, and that grief that would have on that mother, the child, the family, the community, and the impact of that for generations and generations to come. And that's just not a one-off story. That's happened to many of us. Most Aboriginal and Torres Strait Islander peoples do have some sort of connection to stolen generations. So basically the challenge for me in my works was about the environment. It's about the environment itself for MOG when they go into hospital. It's about communication techniques to be mindful of. And so my challenge for that in terms of, providing an initiative or strategy was really about getting out into our hospitals and connecting with the right people who have the same, that we talk about allyship, and allyship is real. We have to have people that are committed to genuinely uplifting, empowering, and fostering reconciliation in action, and who are passionate about health equity. And so having them on site and being able to share with them and connect with them and educate them, I know that our First Nations patients are in the right hands. We want them to feel safe when they're coming into our care. So in terms of implementation of a strategy, seeking out the right people and also having senior executive sponsorship and support is extremely important, because you need to have the people that are the leaders that can create impact on board, and then you can see that things are getting done in terms of success or increasing health service outcomes for First Nations peoples. In regards to what I'm seeing as a success, is I'm seeing people being more mindful in service delivery in our hospitals, so nurses and practitioners. I'm seeing an increased uptake of reconciliation and wanting to learn. And I'm also seeing the First Nations patients feeling much more safe. That's the real change. The first-hand change that I see is the effect that the support and advocacy that I am providing for as a First Nations person for a patient who is a First Nations person. It is creating a real impact. And I believe that connection that I have with them and a similar lived experience, an understanding of their lived experience, is creating a connection of trust, and also creating a feeling of safety. In terms of what we're trying to achieve in the hospitals, we're wanting to see an embedding of cultural safety in our hospitals and an ongoing monitoring and evaluation of outcomes, especially with the Aboriginal and Torres Strait Islander action items or actions within the National Safety Quality Health Service standards, ensuring that we're meeting those standards and not just ticking a box with those standards, but we are actually embedding the standards of what we need in order to reach those requirements into all sort of clinical practice, and ensuring cultural clinical practice capacity building at all levels of the organisation. In terms of barriers, I suppose, of what my work has encompassed, unfortunately, I am only one person, and therefore I do feel a little bit stretched at times, but what I need to be doing in that regard is reviewing the work that I've been doing across the hospitals, starting to work a bit smarter and creating educational pieces for people that are on the front line. And they're understanding more of what's required in order to provide holistic well-being of First Nations peoples. And it's not even just for non-Indigenous, for Indigenous peoples, it's also for non-Indigenous people as well. But if I go back to the fact that we're talking about country and we're talking about caring for country, we're talking about the holistic spirit and flourishing of First Nations peoples. And that will, in order to create that flourishing, we are then meeting better health equity outcomes and improving the health disparities of social and cultural determinants of health for Aboriginal and Torres Strait Islander peoples. that's it from me. I look forward to Q&A afterwards. Thank you very much for the opportunity for CAHA to see that my presentation submission, the importance of it, importance of sharing some of the works that I do and that my team does, Jess as well. And I'm very grateful to be here and looking forward to Q&A. Thank you.
From both of your presentations and just hearing of the great work UnitingCare is doing with the presentation that you brought, Jessica, enhancing elders' wellbeing through environmental stewardship, how important. And Nikki, I just wanted to touch on something with embedding First Nations cultural safety in healthcare practice. You spoke about allyship, and in a changing political movement, that shouldn't change what allyship looks like. So again, thank you for highlighting the importance. As we see in the landscape here in Queensland, as we see in the landscape of Aotearoa, and acknowledging these political landscapes changing and what allyship looks like, because ultimately we do not want that to affect health outcomes for First Nations people. So again, thank you for your work, UnitingCare. We've had a bit of a change to the program based on internet connection, where we were going to go to the wonderful Donna Burns. We're going to go first to Skye Miller from Gold Coast Health. Just wanted to bear with us. With that change, that will bring Skye forward. And Skye's doing a presentation connecting with country and healthcare settings. Skye Miller is a dedicated communications officer within the Aboriginal and Torres Strait Islander Health Service First Nations Health Equity Team, where she plays a key role in advancing health equity by embedding First Nations health principles into Gold Coast Health Everyday's practice. With a strong commitment to values-driven service and teamwork, Skye prioritises the development of strategies aimed at achieving life expectancy parity by 2031, while reinforcing the message that health equity is everyone's responsibility.
To be here today, so thank you very much, and to demonstrate and showcase some examples of how Gold Coast Health is connecting with country in a healthcare setting. I'm a proud Eamon woman, and I would like to acknowledge the traditional owners of the land of where I meet, the Yugambeh people, and for all the traditional owners of where you're all meeting today, and pay my respect to the elders past and present. I extend the respect to any First Nations people here with us today. This acknowledgement reminds us of the rich culture heritage and our ongoing connection to country that shapes our work and our commitment to health equity. Next slide, 2, please. So it has been mentioned earlier that the connection with country in a healthcare setting refers to fostering a deep and respectful relationship with the land, culture, and the heritage of Aboriginal and Torres Strait Islander people. It does recognise that country is not just a physical space, but a source of identity, spirituality, healing, and well-being for First Nations people. So in a healthcare setting, what does that look like? So Gold Coast Health is expressing this through actions that support cultural safety, inclusivity, and the respect for the knowledge and practice tied to the land. So there's a few pictures here that we're going to them. It showcases how Gold Coast Health is embedding connection to country. So at the beginning of an event or meetings, we do obviously a welcome or acknowledgement of country. We like to partner with traditional owners through co-design, so cultural approach, appropriate healthcare. So that's with working with the traditional owners and also do some communication and consultation with different material that goes out or different services that we're trying to embed. So the community has a real understanding or ownership of what's going to be happening, talking about the challenges that they might foresee in that implementation. It's staff and cultural capability within our service. So this is providing training to ensure staff understand the significance of country and First Nations cultures, and also yarning circles. and recognising the link between health and country. So this is addressing the environmental and social determinants of health related to country. The two things that I'm really going to be discussing today that I wanted to highlight is incorporating traditional healing practices. So this is the integration of significant cultural practices into the care models, and we're doing that in collaboration with elders and traditional healers through culture therapy. And then designing spaces that reflect country. So creating welcome environments with art, language and design elements inspired by local Aboriginal and Torres Strait Islander people. So next slide. So this is, the next slide shows the workshops that we've been doing with staff. And then the next slide shows the yarning circles. And then so we get together and we have a discussion on, barriers. And then the next slide now we're going to show you is a video about how we're creating a welcoming environment in hospitals.
Yamamalia, Paulangaya, Gamurangaya. Hi, I'm Paula, and I'd like to welcome you to Tugun Satellite Hospital, Banyaramaba. Throughout this facility, you will see pockets of art, including the sculpture by Wurundjeri artist Grace Brown.
This artwork is important to me because it's something that's close to my heart. From the start, I saw this artwork as a tapestry of life, of healing power and culture.
Bagal Yungai Jimbalungs, here to celebrate the work of artist Grace Brown, who has kindly presented this work for us that reflects country. In our language, country is jargon. When I talk about jargon, it's not the land that we just walk on. It's the air, it's the spirits, it's the ancestors, fauna and flora, and us, humans. It's important that we look after country and care for country, because country looks after us.
First Nations Australians have utilised art to convey complex cultural beliefs and practices across the generations. The use of art within healthcare and hospital settings serves as a visual way for healthcare staff to meaningfully engage with First Nations peoples and culture.
The sculpture is fabricated in a steel that will naturally patina over time. The sun, central in our culture, represents the hospital, while the circles and dots around the rays represent the community and the caregivers, drawing inspiration from the profound connection the Yugambeh people have with the land.
Country is who we are.
When the healthcare facility reflects the culture of its location and of the patient it cares for through art, we can deepen the sense of safety and community.
I'm so honoured that my artwork is now at the Tugun Hospital for everyone to enjoy. I hope it has an impact on everyone that gets to view it in the Healing Garden.
And that's what patients, staff and visitors will find at the Tugun Satellite Hospital, Banyaramaba Healing Garden, through the story of Banyara Jagun, Banyara Garul Junabanyubani. Healthy country, healthy community.
So this video, every artwork, and when we're working with the artists and creating a welcoming environment, we feel it's really important to gather that video and that story evidence so people before visiting the hospital, why they can QR code to find that connection piece. And we've had great valuable feedback from community saying they feel welcome and feel positive about going to the healthcare system or visiting the hospitals. Obviously they only visit there when it's probably one of the darkest or not for a positive experience, but we're providing that welcoming environment for that. This artwork was launched at an event called the Art of Healing, and that was inspired, that name, by Grace's artwork. And with that, then we launched a practice called culture therapy. So I'll move on to the next slide that shows the video of what culture therapy is. And this will provide you an overview of activating the 5 senses in that healing process and what culture therapy is. And I'll expand upon that after.
Culture therapy is the combination of cultural practice woven within our healthcare setting. Things that we've done for many, many years. Those practices that have been health promoting and health enhancing for Aboriginal and Torres Strait Islander peoples. Art, dance, song, language, ceremony, connection to country. Using cultural practice to heal, treat, or to relieve is called culture therapy. It's something that we can embed in our health system. It's something that can be included in every place and every space. We can expand into aged care facilities, early childcare, education, settings that can learn more about the sophistication of Aboriginal and Torres Strait Islander knowledges, places that can celebrate the diversity of our First Nations cultures and their cultural practice, and bring a journey together for healing, together for reconciliation, together because as a community we are stronger. The opportunity to weave cultural practice in a healthcare setting not only provides a strong opportunity for Aboriginal and Torres Strait Islander people to thrive in this environment, but it also gets the community an opportunity to share story, to share the sounds of country, to share the smells of country, to share the tastes of country, to feel country in its essence. We celebrate Aboriginal and Torres Strait Islander peoples and their journey forward, and we stand with them. And we want to see holistic healthcare that takes into consideration a whole person. We're not segmented, we're here as one, and that's the journey that culture therapy is taking. When you feel accepted and heard in an environment, you can start your journey to thrive. And that's what Gold Coast Health is committed to take people on a journey using culture therapy to open doors, to share connection and build community.
So culture therapy has been only launched a few months and it's really exciting. And we've been based the artwork and stories from the We Are 27 creative artwork that's been produced for Gold Coast Health to create that welcoming environment. And culture therapy has been an extension from that inspiration. Paula Rankmore, who you see on the video, is one that created this booklet, and then we, for the event, we worked together to create the culture therapy workshops that were displayed through the video. So our goal was to create that 5 senses of healing, because everyone responds differently. And so the language and song, it was teaching in this workshop the local language, the Yugambeh, and getting those conversation pieces and the humming and the vibration through the body through language. So then they've got the touch, the sensory aspect of weaving cultural connections. So they're physically making something that they take home, the materials from country, but also this is a great connection piece where there's that storytelling of different people's journeys, or just even traditional Dreamtime stories from traditional owners, within those yarning circle aspects. So it creates that connection. Culture therapy and language is a resource that's, produced using colour and healing through colouring in, and that's been then produced to be decals and different things within the hospital system. The digital healing is the sound vibration of the didgeridoo and the vibrations and going through that aspect that has been very powerful and moving. The scent, the scenting, the scent is smell. So smell connects you even in your own family traditions or food, or it takes you back to a place of feeling safe. So there's 4 different scents that we've got that has a different, that brings the smell takes them back to feel safe within environment. And then moving meditation. So that was created using Grace's artwork, which was a soundscape using the story of the artwork and sound rhythms to do a healing, moving meditation within a chair. So it's inspired by local animals, the birds, and using their posture, as you would have seen in the video, of them to move their movement and, breathing and that relaxation, that calm, connection, soul peace, and we're using the headsets, being in that space, and the algorithms of the music really calms people. It's a real Land Living, one of the elders, he has produced that aspect. So from that event, we've actually created a video explaining what each one of these workshops is. And I've got a greater response. So people within the health system, like the health service, are working with me to embed these workshops in Gold Coast Health, to take the resource as a colour resource for patients in the hospital through to staff building and that connection piece. So next month, we're going to be doing a moving meditation at Robina Hospital, where there's going to be 5 different services involved, from palliative care through to mental health, through to the ED, and then a community setting aspect where there'll be probably over a few hundred people in that short time going to be doing the moving meditation and that breaking down that the connection from patients through to staff, and then creating that welcome connection piece for the external community. So from there, we do, I don't know how I'm going with time, but with everything that we do evaluation. So if we click through to the next slide, we always ask to get some feedback from individuals that are participating. So you'll see that we ask the same questions at each of the workshops, and you say that they were impressed, they felt comfortable, but it was very high data in terms of over 80%, a majority of them are saying relevant to work or relevant to our personal health. So they're seeing that if we go to the next slide and then so on, there's 4 slides with statistics. You'll see that it's the same messaging coming through. Everyone felt great positivity around it, and seeing that they can embed this into the health system. Now, we are very supported by our CEO and directors, and we're wanting and looking at ways how we can increase this being embedded into the healthcare system, along with all the other great things that the hospital staff are doing. So if you want to know more information of what we're doing, Paula and myself are happy to connect with people. So you can send us an email. But in closing, by embedding the principles of connecting with country into healthcare organisations, it can contribute to improving health outcomes, fostering trust with community, ensure that care is culturally safe and aligned with the needs of the First Nations community. Thank you for having me, and happy to answer questions.
Well, thank you, Skye. That's incredible work that the Gold Coast Hospital Health Service is doing. I can't help but think about the legitimacy of the relationship with Yugambeh people and the community to get those outcomes. When we think of the statistics of discharge against medical advice, Indigenous people have rates of 5 times higher than non-Indigenous people. Without the great work that the Gold Coast Hospital Health System is doing, which would bring down those figures. If we don't have connection to place, then the DNA did not attend rates will go up. If we don't have, our cultural going in hospital health systems, then we see those rates go up. So again, Skye, incredible work that Gold Coast Hospital is doing, but also that legitimacy, also the cultural therapy and the activating of the 5 senses. When we think of Indigenous ways of knowing, it's beyond one-dimensional. And healthcare delivery can be seen as one-dimensional. We have a patient, we have our ways of interacting with that patient, and here we are showcasing the very essence of going beyond that. So again, thank you.
Can I just jump in and say that when we're looking at the data of the no-shows and to appointments within our cultural safety training program and what we're doing, especially in ED, there's a text committee, we're looking at those figures and statistics and looking at it as a strength base and addressing why they're not coming. So there's a lot of barriers why they're not attending the appointments. And so if you really nut down, it might be transport or so just to know too that when we look at those statistics, we look at what are we doing as a service, how can we improve that statistics, because it's everyone's responsibility, and that's that. And if we get health equity right, we can help everyone.
Absolutely. Again, makes me so happy to see the great work. So thank you for sharing, Skye. I see we have Donna Burns, who has joined us. Thank you so much. Before we go into the presentation of Donna Burns, who is presenting the role of Aboriginal and Torres Strait Islander doctors in the healthcare systems reform. Donna Burns is the Chief Executive Officer of the Australian Indigenous Doctors Association. She is a proud Wiradjuri descendant with extensive experience in executive leadership and governance, with a particular focus on improving Aboriginal and Torres Strait Islander health outcomes. Thank you for joining us, Donna.
Oh, my pleasure. Thank you so much. It's such an honour to be here. And I'm coming to you today from the lands of the Kumbaberri peoples. I'm on Yugambeh country on the Gold Coast, so I see there's a lot of people here that are very close by. I mean, the fact that we're here talking about greening the healthcare sector is really a personal and professional goal of mine. I live in an eco-village, so I'm here living off the grid, and the irony is I was having real difficulty connecting to the internet, so I thought that was quite funny. But thanks for that lovely introduction. My background as far as the healthcare sector is, I'm a registered nurse. I was a clinical nurse specialist for many years in the emergency department. And I've brought all of those years of or decades of experience now into leadership with the Australian Indigenous Doctors Association. So thank you so much. And obviously, when we talk about this important work, I draw my strength from my ancestors, the Wiradjuri peoples, and also the strength of my beautiful mother, who's non-Indigenous, and we, grew up with reconciliation right on our doorstep. So I was very lucky in that regard. So the next slide, please. I appreciate your support here. So obviously we're acknowledging the beautiful countries that come together to form this country that we now know as Australia. So thank you so much. Next slide. Thank you. Today, when we talk about the role of the Indigenous medical workforce and greening the healthcare system broadly, it's really, I think, very important to just touch base on what the vision is of the Australian Indigenous Doctors Association. So it's really about self-determination and equitable health and life outcomes for First Nations people. And that's what I hook everything that we do to. So if it's not about that, then we're not interested, we're not playing. It has to be about improving health outcomes for community and individuals, but particularly in a culturally safe healthcare system. And I'm hoping that today, when we talk through the work that we do, that there's a really clear link for me about climate action and the impacts of climate change on health and our role in that. Because as you can see, I've highlighted that, we are the Indigenous medical workforce, but we want to drive an equitable and just health outcomes. And I don't think that's possible if we don't elevate climate change and climate health impacts. So thank you. So there's probably a lot that's already been discussed, I'm sure, throughout this really important forum about what the impacts of climate change do have on health. But we really need to consider all of these points here, because if we don't take a strengths-based approach and elevate those cultural determinants that embeds Indigenous knowledge systems and rights, reflecting those connections to country, kin, community and spirituality, then if we sit purely in the biomedical model, then we won't see the changes that we need when we talk about the National Health and Climate Strategy. Obviously, the UNDRIP commitment to support Aboriginal and Torres Strait Islander people's participation and planning in implementing climate change responses. So these are all lovely, shiny documents that can sit on a shelf, but it's time for us to actually act on these and make a change. And we believe, as the Indigenous medical workforce, that we've got a pivotal role to play in achieving the goals of all of this important work. So I thought I would start by sharing with you an experience that the Australian Indigenous Doctors Association had last year in the Torres Strait. So we actively campaigned to get some funding to support 20 Aboriginal and Torres Strait Islander doctors and medical students to attend a week-long program called Eagle Yawa up on Thursday Island on Wayben. This was an program that was initiated by Uncle Philip Mills there. You can see on the far right of the screen with his beautiful green floral shirt. Uncle Philip came to me at the Lowacha conference and said it'd be great to take some Torres Strait Islander doctors home because a lot of community don't get to see the Torres Strait Islander doctors who are working both in the Torres Strait but also on the mainland. But as you are probably aware, the Torres Strait is facing an significant climate change crises. They're already seeing the impacts through the rising sea levels and increased temperatures, and that's overlaying what's happening with overcrowding and, seeing significant impacts on temperature just rising also is impacting people's health. So what was really interesting with this visit to the Torres Strait last year is we did a lot of consultation with community while we were there, and the concerns of climate impacts were raised to us directly and to this group of clinical professionals. So community are concerned. They know that the region there's evidence there to say that there's an increase in climate sensitive infections that need to be dealt with on a clinical level, but also we have to take preventative action soon to stop the ongoing threats to health and well-being. So while it was lovely to take community back, it was really important to understand that the people who are living on the islands are very concerned about the impacts. So thank you. The unique medical and cultural perspectives of an Indigenous medical workforce is really important to discuss, I think, in the context of climate change and how we green the healthcare system, because we know that Aboriginal and Torres Strait Islander doctors bring something really unique that the other 99% of the medical workforce don't have. And that is something that we need to be really proud of and aware of. And this holistic concept of well-being is something that absolutely contributes to a culturally safe healthcare system. And I believe that a culturally safe healthcare system has positive impacts on climate costs. So we will talk about that a little bit more. But it's very important in this context to understand that medico-cultural perspectives of our workforce. Next slide, please. So our Aboriginal and Torres Strait Islander doctors as part of our healthcare system broadly, again, in this context is really important because we know that regional and rural areas are seeing the impacts of climate change at a significantly higher rate. Like I said, in the Torres Strait, we had direct communications with community that were highlighting the impacts. We were in Gama last year. We were talking about all of the plastic waste in the surrounding oceans and that impact on food security. We know that there's significantly hotter temperatures, and like the overcrowding that I described comes up time and time again. And what's really interesting in the Torres Strait Islander workforce is that 68% of Indigenous trainees are choosing to in remote areas compared to 46% of all trainees. They are choosing primary health care. So 66% of Indigenous fellows are general practitioners or rural generalists. So again, this primary healthcare space where we can actively work to create culturally safe primary care so that we can get people before they get sick. And if we want to convert that to the carbon costs, we keep people closer to home, we treat them earlier, the impacts on climate are less. So it's really interesting if we think about the valuable role of the Indigenous workforce there. The other thing that's really interesting is that 48% of Indigenous doctors are considering general practice versus 15% of the rest of the community. So they've got, obviously an inherent knowing as well about the impacts on First Nations peoples, and because connection to country, spirituality, kin is all inherent cultural determinants, then that understanding will absolutely translate to a cleaner healthcare system. So next slide, please. Is that better? That was my good side. That's why. Thank you. So when we talk about sustainable care and high quality care, at AIDA, we really believe that we cannot decouple quality care and or high value care with culturally safe care. So we are really mindful that when we talk about high value and high quality, it really isn't sustainable without a culturally safe behaviours, actually. So not just a lens, not just a policy, but we need people to act in a culturally safe way. So when the National Climate Change and Health Strategy refers to building a sustainable, high quality and net zero healthcare system, we actively believe that we must include culturally safe practices in that objective. So the next slide, please. So from AIDA's perspective, culturally safe care is really the core of sustainable care, because we believe that working with individuals and communities to understand the impacts is foundational, that we need to create a work environment that is free from racism for our workforce and our patients, and that we invest in primary care that is culturally safe. So when we think about the waste and the emissions that are outputs from clinical care, and if we think about an Indigenous person possibly avoiding care because the environment is not culturally safe, then we can translate that anecdotally to an increased carbon emissions, because we want to get people early in their healthcare journey. We want to avoid acute admissions. We want to avoid transfers by chopper, plane. We want to avoid the hardware associated with an acute unwell patient. And this can all be avoided or at least minimised to some degree if we can create a healthcare system that is culturally safe, because people will come to us earlier. And that is key, not only to the individual and their family, but to the environmental impacts. And when people are living with the fear of rising sea levels, and then it's really inhumane of us to not offer a culturally safe healthcare system that will also have a positive impact on the environment in which they live. So we will, be actively discussing culturally safe care as part of greening the healthcare system going forward. But not only, there's plenty of clinical examples of where culturally safe care has impacted individuals to the point of losing their lives. And we don't need to go over those because I know a lot of you already know that. But we also need to make sure that the system is culturally safe for our Indigenous medical workforce. So 45% of Indigenous trainees responding to the medical training survey last year had experienced bullying, discrimination, harassment and racism. That's compared to 22% of non-Indigenous trainees. And when we talk about racism alone, 21% of Indigenous trainees state that they experienced racism compared to 7% nationally. So if we reflect on the value that the Indigenous medical workforce brings us on so many levels, and today we've got a specific focus around greening the healthcare system. Not only do we need to keep the healthcare system safe for mob individuals and communities, but we need to keep it safe for our medical workforce. Because I think it's really counter to a sustainable healthcare system that if it's racist and unsafe. Next slide, please. So when we're talking about fostering cultural safety, if the healthcare system is to achieve net zero, then it must not only ask Aboriginal and Torres Strait Islander peoples for their knowledge, but actually embed respect, implement and acknowledge that Aboriginal and Torres Strait Islander ways of knowing, being and doing, therefore the cultural determinants of health, can create the shifts required for health equity and sustainability. And I read that because I didn't want to lose the real essence of how important that is. By normalising those Indigenous knowledges, then we can privilege that in research and policy analysis and service provision. We can really shift then to that more culturally safe, community-focused approach. And we know that Aboriginal and Torres Strait Islander doctors will play a pivotal role in that. So the next slide, please. To create the change that we need to move beyond our good intentions, and we must become accountable and act. Taking a quote from the Lowitja paper, position paper on climate change and the impacts for Aboriginal and Torres Strait Islander peoples, let's work together, and we'll be stronger together. So when we talk to this at the Australian Indigenous Doctors Association, we ask organisations to really be accountable for the actions. So in the context of climate and health for Aboriginal and Torres Strait Islander people, I think the takeaway for us would be that we really understand that you cannot decouple cultural safety and clinical safety. They do not sit in isolation of each other. While we tend to undertake our cultural safety training programs and it's a ticker box and we isolate that to the side, while we don't integrate and embed these practices and see the value of them. And if we have a special interest around climate, then that's okay. There's a really clear link to culturally safe care and decarbonising the healthcare system. So I think that, like I said to you all, I live in an eco-village. I'm really committed to this, and I see a really smart way to connect to people. If culturally safe care isn't what's going to get people going, then maybe the climate change aspects will. So thank you. Happy to answer any questions.
Great work that Ada is doing in developing the next workforce and supporting them within hospital health systems. Again, if we are able to put questions for live Q&A for our panel members, that would be great so that we can create a discussion around what has been presented. So just to recap on the presentations, if I just go through, first we had Jessica presenting Enhancing Elders' Wellbeing through the Environmental Stewardship and Traditional Owner Cultural Practices. Also from UnitingCare, Nikki Burns presented Embedding First Nations Cultural Safety in the Healthcare Practice, followed by Skye, Connecting with Country in Healthcare Settings, and lastly but not least, Donna Burns, the role of Aboriginal and Torres Strait Islander doctors in healthcare systems. I just want to say personally, but I'm sure with everyone within this Zoom, thank you everyone for such wonderful presentations. Now we want to move to a Q&A with our presenters. Before we get started, we're going to be sharing a Mentimeter link in the chat and a QR code on the screen. We would love for everyone to have a think about your key takeaways as we heard those wonderful presentations. And you would like to share from this session, if you could highlight those takeaways, and you will be able to see everyone's responses live in the Mentimeter. So questions. What I wanted to do is ask all panel members. We'll start with Jessica, going through to Nikki. Jessica, how are First Peoples involved in governance in the organisation? And second to that question, how are you supported in your cultural leadership role?
Thanks, Francis. I'll just answer a little bit of this so then Nikki can sort of speak to it because we're from the same organisation. Yeah. So in relation to how First Peoples involved in governance, we have UnitingCare Queensland has a covenant through the Uniting Church to walk with First Peoples in all things they do. So we're guided by that. So from the sort of ground level all the way up to our executive, we have opportunity for First Nations voices to be heard within all levels of governance. So we have an advisory group on reconciliation in which the executive leaders sit in that space with us, and that group's made up of executive leaders but also staff within UnitingCare who sit in senior positions, and they're from First Nations employee voices as well. So I'll hand over to Nick to sort of speak to some of the other things within UnitingCare. I won't take up all of it.
We have, as just mentioned, our advisory group on reconciliation. Sorry, I was on mute, wasn't I? Sorry about that. Yes, so UnitingCare Queensland, we do have our advisory group on reconciliation, and that is our governance body, I suppose you would call it. We hold quarterly meetings, and within that membership, as Jess said, we have our executive members, but also we have members of First Nations peoples who are leaders within their areas, and that they also have their own First Nations groups, I suppose you would call them, like leadership groups, that they provide the voices of those groups, and they bring those voices into the AGR. So we have that, and we're also working on a First Nations advisory panel that will work alongside the AGR and will actually be voicing or providing their voices, or providing feeding in information, which is about cultural ways of knowing and doing and being into the AGR, so that we can have a more informed, culturally informed approach. We also have the covenant, as Jess mentioned. So we do work very closely with the Uniting Aboriginal Islander Christian Congress, and we have our Aboriginal Torres Strait Islander Christian elders that work in community, and they also provide their voices as well. In terms of how we're supported in our cultural leadership roles, we're quite lucky in that where the RAP team is positioned, we're positioned within the mission team of UnitingCare, and so therefore we work quite closely with the other people within the mission team, which includes environmental sustainability, which includes pastoral care, chaplaincy, and well-being, and so we're actually formed to, I guess, be the voices and the true north, I think, in guiding the right way of culturally informed support and care. We're supported by our executives as well. And so, yeah, we're quite lucky in where we are.
Beautiful. Skye, when we look at a system like Queensland Health and the hospital health system, if we were to answer that question from a governance perspective with First Nations people, how is Queensland Health involved in supporting First Nations people in the governing structure?
It's a great question, because I feel it's really important, because you don't have that support from the top down, and it's really, it won't happen for the voices of the grassroots to embed up into the structure. So we have got, we've had 2 meetings now as part of the health equity strategy that we've done. It's been in implementation for 3 years, which stems from legislation. It's been supported and endorsed by our board, our CEO and the executives in embedding that in the health system. And part of that outcome was the First Nations Health Equity Committee, and that is representation from external stakeholders, our local services, through to directors, through to community members and elders that want to represent and have their voice around the table in the boardroom at Gold Coast Health. And they discuss particular topics. Staff come in and showcase the work's being done, and they provide valuable input. And it's that collaboration piece and empowerment of everyone working together to achieve a shared outcome. So that's sort of going along. We have got, like within the health structure, there's identified First Nations. It can be the voice that's embedded throughout Gold Coast Health. So you might have nurses through to liaison officers through to in mental health. So that area is growing, and we are there to support them in that process. But this is different directors seeing the need to employ identified staff. And in throughout that process, within the development of what we're doing with the strategy, on Friday I'm running a Let's Yarn, and that's a community consultation to give feedback from the first 3 years, and we need to have the new plan for the next 3 years. So we're running a consultation event. Their voice, before we start designing, creating the strategy, we want them to give us their voice on what's working, what's not working. And so that's on Friday. So that's that consultation and of getting the voice heard. For in terms of the weave into staff education, we have, which is through state government at First Nations leadership program. So we as identified staff can apply to be part of that program to give us the leadership skills and emerging to provide that pathway and support in that process. Within my role, I've been employed now, I think, for 8 months with Gold Coast Health, and that was an outcome of the First Nations Health Equity Strategy on the Gold Coast. It's in what my role is embedding First Nations and our strategy outcomes within the mainstream hospital system. So my communication message is First Nations health is everyone's business. So I look at to be the cultural lens of what's happening. So different awareness campaigns, if they're doing videos, photos, communication messages, I look at how I can link my team or First Nation identified staff into those opportunities to have First Nations a communication piece or lens of what we're doing. Because I think that's how we're going to achieve health equity within the hospital systems, because it's so large. So it's just working with allies, developing those allies. We have an employee network for identified staff. So we meet and we discuss that, and we might talk about different things that we're facing within the hospital systems or ways that we collaboratively can work together to foster health equity within the hospital. So there are a few things that spring to mind to help sort of give, I feel really supported, and momentum is fantastic within Southeast Queensland with the strategy that we've got in place, and working with UE and then locally Cowan and Wairaka. There's a lot of movement and getting, in the last 3 years, what we've been able to achieve. So, yeah, it's great.
Thank you, Skye. Donna, I wanted to just quickly ask you, but ask the same question differently. As a leader within the sector and supporting, in your position as the executive officer for the Australian Indigenous Doctors Association and supporting the next generation workforce of First Nations doctors, how are you supported in your cultural leadership?
Thank you. That's a lovely question, actually, and because not only am I in this role in an Indigenous organisation where you do feel somewhat safer, you've got primarily an Indigenous board, so our board is all but one member are Indigenous doctors or medical. There's a medical student and there's an independent, beautiful ally that alongside us. So there's Indigenous people, but sometimes we still forget about that cultural load, right? And that that what we do every day can be not, I don't want to say challenge, because it's not like, you know, I just go, this is so cool to be in the 3%. Like, that's my byline all the time. Like, this is just something that 97% of people just miss out on. And I, you know, I just get such a buzz from that privilege. But there is work to be done when we're in these roles, and it does involve a lot of conversations where there's expectations that we all think the same and that all of our experiences are the same. So, you know, it can be tiring, but I get a lot of support from our board from a cultural perspective. There's no doubt about that. But I am on boards in mainstream organisations as well. And that's sometimes where it's a little bit more confronting, because you're isolated. You know, what I described in the presentation around siloing our work, you know, is a constant challenge. And I like for us to be everywhere and surprise people with where we can be. You know, I've done a lot of non-identified roles as well, because I like to say, surprise, you know, we'll be everywhere. Watch out. But just yesterday, I was giving advice on one of the colleges. I'm on a Indigenous Health Advisory Committee for one of the specialist colleges, and their question was, should we have a board member from the board be on the Indigenous Health Advisory Committee? And I was like, no, one of us should be on your board. You know, don't. And they're like, oh. I said, no. So stop. And we will talk to you about finance. We will talk to you about your strategic plan. We will talk to you about your governance structure, and we will talk to you about Indigenous health and training Indigenous peoples. So I do a lot of advocacy around our roles and where we need to be and the value that we can bring across many of the areas of governance that sit outside that beautiful little silo that's been cooked up for us, which can be very hard to break out of. But, you know, I've got my family around me. I've got beautiful friends. I live in this amazing community. And you need all of that too. You need the joy, and you need to get and be healthy to manage what is sometimes hard work.
Yeah, beautiful. Thank you for sharing, Donna. I've got questions coming in, which is great to create that discussion. I just am running a couple of platforms, and Alison, I just want to highlight, she wants to say thank you to everyone for your insights and examples and practical action. But also, how do you think that First Nations people can communicate care for country to non-Indigenous people? I mean, this is something that I come up in the health sector, working as a registered nurse, like our connection to spirituality, our connection to place, that's beyond. And when I think of these, you know, these egocentric mindsets of like someone has to stand up, and we think of Indigenous ways of knowing, which is interconnectedness, and then really trying to communicate that. How do we go about within the sector communicating the care for country to non-Indigenous people? Did anyone want to have a go at that question? Yeah, Skye.
I think my experience with that connection to country, with what I touched on in my presentation, is that they don't realise what country represents and the meaning of it. The Dreamtime stories around, you know, it's not just the land itself. So I think that connection for country, and it taps into one of the other questions that are coming up on that sheet, is I think it's really important that each area connects with their elders or their language, or within there where they're living, to create that story, that connection piece, artwork, or something that's, really important to that. Each country, each mob has a different thing that's important, and the messaging and the storytelling. And I think that is the first place to start to help in that communication for caring for country. And once you have that and everyone's on board, the resourcing or the structure around that and encouraging, the organisations, or that's where I think that's where it'll stem. And every place has different ways that they're going to work, and different learnings that will work within a workforce or a place. So does that help answer the question?
Yeah, absolutely. Yeah. Did anyone else want to have go at answering that about communicating connection to country? And
Donna, you go.
yeah, sure.
Oh, that's okay, Nikki. Thanks. Look, I just think there's some pretty clear principles that we should all be working to protect the planet. And a byproduct of that is that you're protecting the communities of which Indigenous people have walked upon for 60,000 years. So I think, obviously that communicating what country means to us is a difficult thing to translate. Like, I think this is really hard to describe. I took my 10-year-old granddaughter back on Wiradjuri country out to Tubbagah to the reserve, and she was standing on the ground and she said, I feel so strong here. I feel so strong here. And like, that's a 10-year-old unsolicited comment that she felt. So it's really hard to translate that. But if we respect Mother Earth and the country that we're on and do our best, I think a byproduct is that you are actually respecting the lands of Aboriginal and Torres Strait Islander peoples in this country. So I always find it very hard to answer those things because it's such an innate feeling. But just by loving nature, it's got a flow-on effect.
Absolutely.
It is a feeling. If I just follow on from Donna, it is a feeling. And I think unless you're there on country with your shoes off, feeling it through the ground, like your granddaughter there, Donna, cultural immersion experiences are everything. If you are guided by traditional owners or custodians and elders, if you're there on country with them and hearing their stories and their journeys, and immersing yourself in that, then you will feel it. Even non-Indigenous people, you'll feel it. You'll feel something. And I think we're trying to educate people on what it means to be, to feel it, then you have to just go and do it. I think is really, be on country and be respectful.
Absolutely. Did you want to say something, Skye or Jessica?
Yeah, I suppose with what you were saying, Nikki, it's also to being empathetic and connecting with the person that you're talking to, because they have their own cultures or understanding or how they connect with what makes them their identity too. So that's what we talk about with if I get asked that question, like, how do I feel? And how do I ask the question, are you identified, or, or connect with people, Aboriginal Torres Strait Islanders? If you go empathetic and find out information about them and their country and their culture and their family background, I think that helps them create that, because they have some connection piece to that connects and gives that explaining of how we feel about country as well.
Yeah, beautiful. During COVID, we saw the strength of self-determined health services and cultural liaisons officer safeguarding community health. I asked the question, how can cultural safety care prepare us for the shocks and stresses of climate change? When I think of, it was said in one of the presentations about when country is sick, we're sick. And I can't help but think, as a registered nurse working in the parameters, when I'm taking the observations of a patient, and what we do when those parameters are breached, whether it's blood pressure, whether it's respiratory rate, and how we innate a reaction. And here we are, you know, to safeguard. How can culturally safe care prepare us for the shocks and stresses of climate change?
I'm happy to have a crack. How does culturally safe care prepare us? I don't know how it prepares us, but I think culturally safe care can be flipped around and support us during a climate crisis. I think we can flip it around the other way. Because I'm kind of a bit hopeful that we might be able to work our magic and kind of avert ourselves from this catastrophe that's on our doorstep. So I find that hard to respond to in the way that question was answered. But I truly believe that culturally safe care will help us through it and help us really manage. I mean, like I said in my presentation, if we can see someone early in their illness journey, I mean, you know, if someone's sitting at home feeling like they've got a respiratory illness coming on, we want to stop them being intubated, right? We want to stop them flying. I mean, let's take out the people and the beautiful, you know, soft stuff around keeping families safe and well. But this individual, the carbon costs of that admission will be significant. But if that person had got in early and felt safe enough to go into a healthcare system early and was given some antibiotics, then that all of those carbon costs associated with intubation and waste and transport and bringing family, you know, on the journey and flying people in and out in remote areas, or, you know, we all know what the transport's like to get to and from appointments. And if the one detractor from going early is that the system is culturally unsafe, then that's not okay. Not only does the person get really sick and probably will be more unwell than they need to be, but the planet will suffer.
And while others are thinking for answers, thank you for sharing, Donna. It makes me think back to the elders where I grew up in Zeretkest, which is now known as Torres Straits. I grew up on a remote community on Skye, and you know the interconnectedness of when to sow seeds based on the constellation, when the wind changes. You know, we talk about connection to country, connection to place, and these elders, these stewardships of knowledges that are handed down. This is not a fantasy, but this is the understanding of how, you know, climate change is affecting place. And you know, when I think of these knowledges, it's like to prepare us for the shocks and stresses of climate change. The culturally safe practices of knowledges that can be, you know, the spirituality, the understandings. I think is so rich. And I think when we are working in the hospital health systems, when we're working with community, it's to understand those knowledges that, you know, are being inherited by the next generation in preparedness for the shocks and stresses. And I think these are the legitimacies of the teachings in a changing climate. And we really have to, you know, take that on just because it's not the majority's ways of knowing and being. And here we are sitting in a minority. We have to take on those perspectives in the way they connect to place in connection to country. So, yeah.
I was going to say, when Donna was speaking, and then you, Francis, in speaking and articulating that so well, it's not really about culturally safe care preparing. It really is about cultural knowledge, and the fact that these fellas need to start listening to our old people, and be taking on, like you said, you know, they knew what they were doing. They were guided by country. They would sow seeds and they know when to go out, you know, when the mullet has come along, and, you know, they lived sustainably. They lived, you know, they were cared for the environment, and they only took what they needed. And so therefore, I think in terms of, it's not really about culturally safe care, it's about cultural knowledge and understanding and sharing that. But yeah, they have to listen to us in order for that to happen, you know?
Yeah. I've got more questions coming through, but Jessica, I wanted to go over to you. In your presentation, you said you have 2 traineeships within your presentation. Is there an opportunity, or is it restricted by funding to up those traineeships? I think, did I hear correct, and there was 2?
Oh no, so it's a minimum of 2. So we and that's just purely with the CAHA partnership. So we actually have a range of traineeships, First Nations students and trainees throughout UnitingCare. So we facilitate a good number each year, but just particularly with that one service in the partnership with the CAHA, because that's actually, that initiative was first based in Cherbourg. To really benefit the CAHA people within the Cherbourg community, but we have now that out to other sites on the CAHA country as well. So but that's just the bare minimum of what we have promised and will deliver in our partnership with the CAHA peoples. But we have, we currently just in one service arm of UnitingCare can facilitate up to 19 trainees through one program, and then per year, and then within our Penang Bar services, which is our Aboriginal and Torres Strait Islander led aged care facilities and family support centres and drug and alcohol support centres. We also run funded traineeships through those Aboriginal services, as well as on top of, in our other service areas, we facilitate First Nations trainees as well. So no, definitely more than 2 a year.
Yeah, beautiful. Sorry for my.
No. I just, sometimes when you're speaking from a lens of only about, that one little sort of service area, that sort of tends to happen. But we've actually got big plans within UnitingCare at the moment in focusing on First Nations leadership development opportunities. So we have a mentorship program that we run. It's in our second year, where we team up any First Nations aspiring leaders, so they can be from entry-level positions up into senior leadership, and they will get mentored by an executive or a senior leader within UnitingCare for nearly 12 months and expose them to all different leadership opportunities within our organisation.
That's beautiful. Skye, I wanted to then ask the same question to the Gold Coast Hospital Health System. Do you know the figures of those traineeship programs for identified positions, and what are some of them as we, build the skills of the next generation?
Yeah, definitely. So we've got a pathway that we're working on. So an outcome from our health equity strategy was a workforce officer that's just been in the position for the last 6 months. So she's working on a strategy, but we have been working, which is embedded into the health system, with cultural capability. And they actually have trainees, so school traineeships that come in, that they come along for a year and do they choose their field of what they want to learn more from. And then from there, you've got the Deadly Starters cadetships. So these are cadetships that have just been closed. So we've got 12 starting next year. We had 9 last year. So these are students that are doing apply in all aspects within Gold Coast Health. Until I started working here, I didn't realise there's so many career paths. So you're looking at the admin and corporate through to obviously the medical aspect of that. So we've got those, and those traineeships are looking to be continued and provide them 1 day paid work over so many hours in their field of their university degree. And then with that, looking at ways that we can place them into jobs at the end. So people apply, and then so this is happening statewide, not just obviously part of Gold Coast Health. This is Queensland health initiatives that are happening. One thing that is unique to Gold Coast Health is that we do scholarships for school students, and looking at funding and supporting them with the costs of maybe, and people apply, and go through that process and reviewed, and might get up to some money to support them in terms of, don't quote me, but I think it's $2,000 to be able to, buy IT or books, resources to support them in their schooling journey. So, and we're looking in terms of like with those identified staff in those positions, that it's changing and the numbers and statistics. Part of our health equity strategy, we have to have a percentage of 3% of our workforce to be identified. So we need to keep on looking at that and see where the trend is and, support that aspect within our health system. So it's looking at that, but it's partnering with the UnitingCare and finding out about that aspect. I've got an e-news, so I can promote those to the community on the Gold Coast about those opportunities and supporting those pathways and the service delivery models, because it all works together. So it's working collaboratively in the workforce to and support them when they arrive, when they come to, not have that cultural load, how we support them through the employee networks and systems and within Gold Coast Health to stay.
Yeah, absolutely. And that's a real thing within as we develop, but also not burdening with cultural load with anyone coming through the system. Nikki, I just wanted to go to you about, allyship and the political landscape, and what does allyship look like for UnitingCare when we think of traineeships? What are the hospitals that you work with? What is that collaboration? How are we supporting the next generation through programs and traineeships?
Well, in terms of traineeships, it is a little bit tricky with the hospitals because, we need to ensure that there is, for them to be placed in a placement situation, they do need to have some form of qualification or formal skills and knowledge. However, we have the Career Trackers internship program just maintains all of that workforce remit. But we have some Career Trackers interns that have been placed in some of our hospitals. We have usually we have about 6 placements or internships per year, and 3 of those have been placed in one of our hospitals at the Wesley there. We had a med student that was placed in with Allied Health and really loved his experience there. We also had 2 nursing placements as well. So there is those opportunities in building our presence and building our First Nations students that are coming through, they're still doing their degree with Career Trackers. We also have our nurse grad program as well. So we really try to encourage the attraction element, I suppose, in talent acquisition for First Nations peoples to be looking at nurses that have just graduated coming in and being part of our nurse grad program. We have one starting in the new year up at St. Stephen's Hospital in Hervey Bay. And so we're wanting to build on that because our workforce, our First Nations identified workforce in hospitals is quite low. So it really is a piece of what's stopping, or where's the gap there in terms of attraction, recruitment, retention. It is a little bit tricky with our hospital, but we're trying to work harder on that. And I think really it's about providing a culturally safe workplace to be in. And so that's really been my main focus at this stage.
Yeah, beautiful. Great work. Donna, what are the numbers of the trainee doctors within Australia as we stand? What are some of the statistics?
Muting. So we have around 700-ish doctors. So 800. Oh, sorry, I've got my strategic policy person online. She's just come up with 400. I'm sorry, 800. We've hit 800. So we've got 800 doctors, which is fantastic because we're always monitoring APRA for those registrations. And we've got 460 odd students now. So we are getting very close to 1,000 doctors, which is fantastic. Wow. We've got about 770 members at AITA. So we're very proud of the work we do. We've got specialists at about 0.3, 0.4% of the medical workforce. So we've only got, in the 100 to 200 bracket for non-GP specialists. So we still have a lot of firsts. So we had a first cardiothoracic surgeon last year. We just had our first exercise and sports physiologist. So there's still a lot of firsts for Aboriginal and Torres Strait Islander peoples. However, let's not take away from the fact that over the last 20 odd years, we've gone up to over 800 doctors now, which is incredibly impressive, and of which there's around 160 Torres Strait Islander Francis from Skye up there in the UnitingCare. That's incredible. So many first in family for Aboriginal and Torres Strait Islander doctors. We are starting to see second generation doctors come through, which aligns to how medicine's been right over the years, very, very intergenerational. So to have these kind of figures coming through now, and when I talk about the so what of the number of doctors, for me, it's so many different parts of closing the gap. It's economic participation, it's education, it's housing. If someone becomes a doctor, then probably less likely to end up in the justice system. I'm not saying it wouldn't ever happen, but there's so much around closing the gap that becoming a medical officer does.
Yeah.
Not to mention that, that extra layer of cultural awareness and cultural ways of knowing, being, and doing that you just inherently bring, which is unquantifiable.
Absolutely. It's on the spot, but real quickly, which state or territory is leading those numbers that you share?
Well, I can have a look. It is New South Wales, but Queensland are hot on the trail.
Yeah, beautiful.
So, yeah.
Exciting.
Yeah, and remembering that Newcastle was the first university that really supported a pathway for Indigenous peoples. So that is still kind of a university that led the way and still kind of leads the way. So, but we've got now 23 universities across the country that are all committed to this, and 16 colleges.
Beautiful. Did you have something to say, Skye?
Yeah, I just want to add thing with when I'm looking at with what we're doing at Gold Coast Health and creating those numbers and those opportunities. I think it's really critical in the engagement process with the workforce is looking at schools. So I see cultural therapy for us and the Deadly Choices program that our local service provider Cowan is running, that I want to be able to get in there and showcase, for example, Gold Coast Health and the diverse array of job opportunities, because they might not be aware. I think, you can assume, but, the guidance counsellor at the school is overwhelmed. So I think to help support those statistics, and hopefully in 10 years' time, we're all working collaboratively and schools are aware and we're engaging with the youth officers or maybe Indigenous officers at the school. Because I think that's correct. To see the statistic, the opportunity.
Yeah. Thank you, Skye. Well, as we come to an end of our session, I want to extend a heartfelt thank you to our speakers for their generosity in sharing their stories and experiences with us. I'd also like to thank all of you for joining us today. And I want to note, don't forget to explore the event stream button in the app to share updates or connect with other attendees. The meeting hub is also available for networking, so please make the most of it. And I want to thank Bupa for bringing this to life. And looking ahead tomorrow, we have a workshop hosted by Croaky on making the news, followed by session 5 on stories of healthcare resilience. We hope to see you all there. For now, feel free to stay on or continue with conversations with our speakers or other attendees. Thank you all again for being part of this journey towards a more inclusive and sustainable healthcare sector. And a reminder that this is not just First Nations people's business, it's everyone's. Thank you.